So my talk is going to be on next generation hybrid imaging and refractive surgery. Thanks AIOS and Oculus for this opportunity. I do research with Oculus, but this has no impact on my presentation today. So what does a refractive surgeon want today? He wants a good tomographer, a screening tool, something which can help with biomechanical and strength assessment, an optical biometer, and a pupillometry and abbrometry, which needs to be used both in cataract and refractive surgery today. So what does the new hybrid tomographer, topographer, the Pentacam AXL wave has? What's new? How is it different? Its repeatability and effect of tear optics and repeatability and relevance. The number 3 and 4, we have a separate paper on this by Dr. Reshma, my colleague. So I would not be talking about it. I'll speak on the other aspect of this hybrid tomographer. When we look at different topography machines, the Pentacam HR came in with a lot of focus on looking at a very, very sturdy topography and very repeatable as in all forms of refractive and keratoconus patients. Then came AXL, which looked at the biometry, which added a new dimension. Now you have an abbrometer to it, and that's what the wave is all about. These are all the different principles used: Hartmann-Shack, partial coherence interferometry, rotating Scheinflug, are all these methods used here. The sequence, when you look at the full sequence, you have a lot of things. This we are used for a Pentacam user, but what is important is it also gives you this sequence, which is new: the AXL scan, the IOL calculator, the abbrometry, the visual performance. So suddenly a new dimension comes into the picture. This is how it looks, the abbrometry, and this you can look at the corneal, internal, and total aberrations, and this gives you a complete picture, what we used to seeing in a different abbrometry as a special standalone tool. So if I use an eye trace or one of them, you have to have a standalone tool which is different. And this is the corneal aberrations. It gives you a quality of vision, which was not there before. These parameters we are already used to. And it gives you a total one also, which tells you the total abbrometric refraction. And this is very, very important because it gives you not the refraction, what you like in non-contact tonometer, but it gives you a complete abbrometric driven aberration. I'm using the word abbrometry driven. And you can always correlate to our favorite tool for looking at an early cataract. Dysfunction lens index was something which was used for an eye trace, which is a standalone abbrometer. Of course, you do have a keratometry topography there, but it's more of a Placido disc. But here we have something called the PNS, the Pentacam nucleus scaling, and this looks at the aberrations or the densitometry changes of it, which can be used in our practice. And this is 0, and you can see that this is the densitometry 1, which is already there. Retro illumination, especially you're doing premium lenses to look at how is your lens centered to the center of your pupil or your Purkinje image there. The axial length, it gives you the different axial length like any good biometry. And IOL calculator, which has this kind of format, is similar to a lot of biometry machines we all use. Biometry is part and parcel of cataract now, and signal to noise ratio of all your values which can be given. And there are papers which has compared, which says that this is as good as the conventional or available biometers in the market. A lot of formulas for you to choose and play around with it, and how you choose your IOL formulas or through different calculators. This is something which is inbuilt, and just like any other biometer, you can do a topography, then look at an aberration, then do an axial length, then look at all the formulas which is already inbuilt. Is what is the beauty of it. And you can see that all these factors can all be fed in, and you'll all get all these changes, which is very useful for a modern day cataract surgeon. When I say modern day cataract surgeon, the cataract surgeon who values the power of corneal diagnosis, the power of knowing everything before he puts the lens. He values the power of the way the corneal astigmatism is behaving, both the anterior and posterior, and also the impact of aberration. All this, if you are a modern day cataract surgeon, you should know, and that all goes into planning your IOS. And all this is completely built into this machine. So how is it different? I've told you already, it is a one machine which is completely mix of multiple things and built into perfection. So what happens is it gets you all that what you need to do if you're using any of the other abbrometers or topographers, that it's only part and here and part there. So you get everything on one go, and that is how it is completely different. I'm going to skip these slides in the interest of time, because this my colleague is going to speak, so I'm not going to go into this. So basically, this is a single instrument which looks at your tomographer, which you all know, the aberration, corneal and ocular, and the biometry. And that's what is the power of this